Hello. This video is an introduction, easy-to-use tutorial for patients living with chronic obstructive pulmonary disease and their caregivers. Whether you're a patient living with COPD or a caregiver, this video contains instructional information on how to identify your daily controller medications, medical devices, if any, to use while administering those medications, and proper technique. Please feel free to subscribe to this video library, as there will be more videos available on topics including identifying rescue medications in acute exacerbation situations and identifying early warning signs for an exacerbation and much more. Let's get started. First and most importantly, how do we identify medications that are needed on a daily basis? One easy way to do that is to read the prescribed label issued by the pharmacist at the time the medication's been prescribed to the patient. Oftentimes you'll see language that includes take once daily or take in the morning time or at bedtime. You might hear your physician or respiratory therapist use the term LABA. That's for your long-acting bronchodilator. This medication is used daily as a controller medication to help control your symptoms. For example, wheezing or shortness of breath that can get worse when you're doing yard work or simply going from one room to the other in your home. What's important to know is that these controller medications are to be taken every day to control your symptoms and deter from worsening symptoms that could potentially lead to hospitalization. Some of those long-acting beta agonists, which we refer to as controller medications, are known as Ceravent, Spiriva, Brovana, just to name a few. I'll provide a list of those medications and more at the end of the video, so it may help you, the patient or caregiver, to identify a controller medication and properly label it. I do have some examples for you. This is a dry powder inhaler, which is a daily controller medication, which I've taken some soft tape and labeled with a Sharpie. The instructions on the prescription say to take in the morning and take at bedtime. Another controller medication is a metered dose inhaler. Again, I've labeled take in the AM and at bedtime daily. With these types of inhaled medications, we always recommend that you use it with a spacer, which is also labeled use with your blue inhaler. Identifying it by color may help. You can also write the medication name on your piece of tape, but this device is particularly important because it helps with the depositing the medication into the patient's lungs to help control the symptoms. It is important to note that some medications that have the same name can come in different varieties, a dry powder inhaler or a metered dose inhaler. These are some examples to help you identify the medications. Medication technique and use. So now we're going to talk about technique when taking controller medications. And there's some important things to identify. First being, what type of medication are you being prescribed? Is it a dry powder inhaler or a metered dose inhaler? If it's a metered dose inhaler, these devices have a set counter of inhalations, which are typically on the back of the device, that alert the patient and let them know how many more inhalations are available to them, so that once it gets closer to the end of this prescription, the patient and or caregiver knows it's time to get a refill. With dry powder inhalers, these devices also have counters which alert the patient and the caregiver when it's time to refill the prescription. What is important to know is that after taking either one of these medications, the patient must rinse his or her mouth to prevent from developing an infection in the mouth, commonly referred to as thrush. Now it's time for technique demonstration. This demonstration will involve your metered dose inhaler. One of the important things to know is if this is a new inhaler, you need to take the cartridge out of the inhalation case, warm it up in between your hands just with a couple of gentle rolls. Place it back into the case, take your cap off, point it away from you and or the patient, and administer one puff. This is to prime your medication so that it's ready for administration. The next important factor that we need is our spacer, which we discussed earlier in this video. There's an insertion hole where you want this device, this piece right here on your insertion site, to be facing upwards. Just gently place your inhaler inside. You instruct the patient to create a tight seal with their lips around the mouthpiece of your spacer, which they'll do. Then you will administer 1 puff and encourage the patient to breathe in and out gently, but do not make noise with the inhaler. Here's proper technique. Notice I didn't make any noise with the spacer. Here's improper technique. If your spacer makes a musical sound that sometimes sounds like an accordion, that's improper technique. You need to be careful because you're breathing too hard, too fast. Slow down your breathing. It's important. We want to get as much medication inside our lungs as possible. Follow your prescribed inhalation, whether that's 1 or 2 puffs, written on your medication label. Now we're going to discuss the technique of a dry powder inhaler. You may have a discus. There might be a turbo inhaler, which looks like a metered dose inhaler, but it has a twist bottom. Unfortunately, we don't have that right now for the video. However, with the discus, you're going to open it up. You want to leave it flat or horizontal. Prime by pushing this. You'll hear the click, it'll click back. Again, you want to instruct your patient to make a tight seal around the mouthpiece and take a very fast 1 breath like you're sipping through a straw, so tight mouth, and then you want them to have a 1 to 3 second, maybe 5-second breath hold at the top of that inhalation, and then promptly rinse with water and spit to prevent any possible infection, also known as thrush. It's important to note some side effects of long-acting bronchodilators that patients might experience, and those include dry mouth, dizziness, tremor, runny nose, irritated or scratchy throat. If you're experiencing any of these side effects or symptoms, it's important, and I encourage you to discuss these with your prescribing physician. There are medications, other medications out there on the market that might be best suited for you that will limit the side effects you experience. I hope you found this educational video helpful in identifying your controller medications as well as using the proper techniques. Breathe easy, friends, and don't forget to visit my video library for other educational tools and techniques.